The main symptom of irritable bowel syndrome is the chronic abdominal pain. This pain is most often associated with transit disorders, constipation, diarrhea, or an alternation of the two, more pronounced during flare-ups. This type of chronic symptomatology is related to a lower digestive tract dysfunction. The pathophysiology of irritable bowel syndrome is multifactorial. Digestive motor disturbances alone cannot explain irritable bowel syndrome. Their presence is inconstant and random. Stress and psychological disorders may also favor the onset of pain, in the same way as a secondary infection or inflammation following diarrhea. All these factors lead to visceral hypersensitivity. This plays a key role in the genesis of irritable bowel syndrome. This is a true hypersensitivity through the lowering of the pain threshold, regardless of any change in the mechanical properties of the colonic wall. The pathophysiology of an irritable bowel consists of 3 stages. The first stage is the increase in paracellular permeability. It may last from a few minutes to a few hours. The second stage is the microinflammation of the mucosa. It lasts a few hours to a few weeks. Nerve-ending sensitization corresponds to the third stage and can last from a few weeks to a few years. First of all, let's consider the increase in paracellular permeability. Aggression of the colonic epithelium by stress or by toxins, bacteria, or food antigens present in the intestinal lumen results in the opening of the colonic epithelial tight junctions, thus increasing the cellular permeability. These toxins and antigens penetrate in the colonic mucosa. They are at the origin of both a low-grade mucosal inflammation and of hypersensitivity. This microinflammation of the mucosa is characterized by the increased presence of immunocompetent cells as lymphocytes, neutrophils, and mastocytes. These activated cells release pro-inflammatory mediators and algagens. Nerve-ending sensitization caused by these mediators is the third stage in this pathophysiological sequence. Substances released by activation of mastocytes, neutrophils, and lymphocytes sensitize the digestive nerve endings or the afferent primary neurons and result in the development of hyperalgesia. Parietal mastocytes in contact with the afferent neurons play a key role in lowering the sensitivity threshold of the nerve endings. There is a close correlation between the number of mastocytes, their degree of degranulation, and the severity of the symptoms. Tryptase histamine, nerve growth factor, or 5-hydroxytryptamine, released by the mastocytes, are recognized mediators of visceral hypersensitivity. Lymphocytes also participate in the hypersensitivity. In view of the pathophysiology of IBS, antispasmodics constitute a first-line treatment. Opting for medicines that work on visceral hypersensitivity is logical and provides a real benefit to patients. Finally, it appears that any substance or medicine aiming to restore a normal colonic permeability in the first stage of the pathophysiological sequence would prevent visceral hypersensitivity. Simethicone acts on the permeability of the colonic mucosa. By coating the mucosal lining of the colon wall, it constitutes a protective barrier that limits the penetration of external pathogenic agents, thus fighting against the increase in paracellular permeability. Simethicone also allows for the coalescence of gas bubbles trapped in the intestinal villi and facilitates their evacuation. Alvarine is a musculotropic antispasmodic agent that works by blocking the calcium channels of the smooth muscle cells of the wall, relieving the spasm and helping to normalize bowel transit. Additionally, Alvarine has an anti-nociceptive action. It decreases the excitability of the mechanoreceptors in the wall and thus the transmission of pain messages. More specifically, Alvarine also acts on afferent nerves. It is a selective antagonist of 5-HT1A receptors. It inhibits the excitability and the transmission of pain signals, hence its anti-nociceptive effect as well as an increase of pain threshold.